Today I am going to talk about monkeypox. How many cases are reported in the world? What are the common signs and symptoms of monkeypox? How it is diagnosed? And how we can treat and prevent this infection effectively. I am Dr. Nadeem Sajjad Raja. Please do subscribe my channel and like my channel. Monkeypox is a zoonosis with incidental human infections. First case was reported on May 7 this year. This is the largest ever outbreak in the United Kingdom. Several thousand cases are reported from the Europe as well. The highest number of cases are from Spain, around 800 cases, Germany approximately 700 cases, Portugal 348 cases, and approximately 1,000 cases in the United Kingdom. More than 200 cases are reported from the United States. Rest of the world, more than 4,000 cases are reported. Monkeypox was first discovered in the monkeys which were kept for the research purpose in 1958. First human case was reported from the Congo in 1970. It is a rare viral zoonosis origin by monkeypox. This virus belongs to orthopox genus, Pox viridae family. The other members of this family are variola virus, which causes smallpox, vaccinia virus, and cowpox. Monkeypox is endemic in Central and Western Africa, and usually people who travel to that part of the world, so they acquire monkeypox during their stay over there. Symptoms are similar to smallpox but milder in monkeypox infection. So main difference or diagnostic symptom between both are monkeypox patients suffer with lymphadenopathy, swollen lymph nodes. Incubation period is 7 to 14 days. That is the average. Rash is a raised spot. It typically appears first on the face before spreading to the extremities, on the sole and palms. So these are small fluid filled blisters, and after 2 to 4 weeks then they scab. The other symptoms, because there are two phases, the first phase is a prodromal phase when person develops a fever, lymphadenopathy, backache, myalgia, and after 3 to 5 days rash appears. So initially it is a macule. Initially macules appear, then papules, and after papules, vesicles, and then pustules. The fifth stage is scabbing of these pustules. So this phase lasts around between 2 to 4 weeks. Monkeypox spread by rodents, primates, and then human to human infection can occur, especially due to the direct contact with the secretions of the infected person. Mortality rate is low in West African strain of monkeypox virus, while Congo basin mortality rate is slightly higher, up to 10%. Mostly monkeypox patients are young adults. So whenever any patient comes to your clinic or emergency, so examine the patient, take history very carefully. Travel history is very important, or contact with the known case of monkeypox. So collect the sample from the vesicles, inform to the lab, take the sample viral swab in viral medium, send it to virology lab for PCR testing, inform to the lab so they can take preventive measures before processing the sample. It is very important if someone develops rash or vesicles, isolate that person, advise that person not to have contact with other either family members or friends or anyone. Hand washing is very important to get rid of this virus. Avoid contact with the known cases of monkeypox, especially those people who suffer with cancer or they are taking medication to suppress their immune system. They pay attention and not to contact with monkeypox patient. There is a no specific treatment, but this infection can be controlled by different measures. For example, antivirals like acidofovir, brincidofovir, tecovirimat, vaccinia immunoglobulins. Smallpox vaccine is very effective. It is effective in up to 85% of patients. This video is just for the information, so please contact your local doctor or public health for further advice, or your nearest hospital, so they will follow the local guidelines. This video is just for the information. Thank you very much for watching my this video. Please do subscribe. Thank you very much.